I have, excuse me, apologies from Councillor Henry Wheeler, Dr. Eric Kerry, and Victoria McGregor-Riley. We have Councillor Chris Barnfather substituting for Councillor Sinead Anderson, Councillor Kate Fole substituting for Councillor Sheila Place. We've got Dr. Jill Langridge substituting for Helen Smith. Lucy Peel is substituting for Colin Pettigrew, and Sue Batty is substituting for Melanie Williams.
Fantastic, thank you, Adrian. Item number 2, declarations of interest. If anybody here present has any disclosable pecuniary interests or private interests, pecuniary or non-pecuniary, now is the time to declare them. Or if you remember later during any item of interest, feel free to interrupt and declare. Number 3. Minutes of the last meeting on the 5th of July. Please note that these are for factual correction only and not open for discussion. So the minutes of the meeting, I'll go through the pages. Page 1, page 2, 3, 4, 5, 6, 7, 8, 9 and 10. I'm going to ask that we accept those as a factual representation, and all those in agreement, raise your hand. Adrian, can we record that?
Okay.
Now, we have a packed agenda this afternoon, and those of you who've got an agenda in front of you will see that there's quite a amount of things to discuss. We're quite limited in time. It's not often I get time limited, but everything's got its own time in order that we can get through the early stages to a very exciting 3 o'clock workshop where we have a triangulation of inspection of Nottinghamshire County Council, from CQC to self-assessment to patients to carers, and it is a really a fantastic document with feedback. And at 3 o'clock we will leave here and go into the assembly rooms. We'll have some tea, we'll have some coffee, we'll have some biscuits, and we'll sit around the table and discuss the report. But it is a fantastic read and a great document for us to be able to contribute to. So that's at 3 o'clock. Before 3 o'clock we've got to get through family hubs, the joint strategic needs assessment, Better Care Fund and the work programme. But we're going to start with the Chair's report. The Chair's report can often have up to 100 items in it, but mercifully today it's got only about 30 items. I'm going to jump to the end of it, number 19 on health inequalities. It talks about the rise in ADHD prescribing, etc. And that's quite interesting because it ties in with item number 6, which is the Joint Strategic Needs Assessment Work Programme. And one of those things on the work programme is actually the introduction of a new chapter on neurodiversity, which I think will be very interesting when we get on to that. ADHD, particularly in adults, obviously has seen a great rise over a period of the last number of years. And out of curiosity, yesterday, I looked at the last person we had referred for ADHD into the neurodiversity referral scheme. And the letter that came back to them said that we have a minimum 30-month, yes? Hang on a minute. You can move closer. Yeah. Is that any better? Yeah, right. If you want it moved away again at any time, just raise your hand. So in terms of the neurodiversity, the last person we referred as an adult got a letter back saying that there is currently a 30-month wait to be assessed in the NHS for neurodiversity. And yesterday when I checked the last child that we referred in for ADHD, it was 24 24 months wait to be seen. So that's a child who wants to get assessed, who wants their school to have special provision, etc., etc. 2 years from the date of referral, and adults a minimum of 30 months, 2.5 years. The exciting thing about that is that it is part of our joint strategic needs assessment, and one of the things about the Health and Wellbeing Board is to recognise the needs of the community of Nottinghamshire and be able to respond appropriately. So I think that's an interesting area, and we'll come back to again today. If we look at the very beginning, we look at creating sustainable, healthy and places where it's good to live. And most recently, we had a motion passed in council looking at the expansion of the water fluoridisation scheme for Nottinghamshire. Water fluoridisation has been around since the 1950s, since it was introduced in America, 1960 in Birmingham, 1970 in North Nottinghamshire, and currently covers about 1/3 of the population. Within Nottinghamshire, we know in the most deprived area, up to 37.5% of the kids have significant dental caries, causing huge problems from pain to lack of sleep to poor nutrition because they can't eat food properly, to social isolation, to halitosis, to missed days at school, etc. And a number of kids been admitted through casualty departments and other areas for dental clear-outs under anaesthetic, etc. There is no doubt that the significant amount of illness, i.e. the 37.5% of dental caries, represents nothing less than a significant burden of disease. And we as the Health and Wellbeing Board are duty bound to intervene where that exists. Not only is it a burden of disease, but it's preventable. We know that water fluoridisation can reduce dental caries by up to 30%. Indeed, 15% of the entire child population of Nottinghamshire would be free of any dental caries if we introduced the widespread fluoridation tomorrow. So not only is it preventable, but it's also a man-made inequity. It's an inequality. We have our own county where we give 1 in 3 kids fluoridated water, and we don't give the other 2 kids any fluoridation, which is over 30,000 children, 2/3 of the population. And we know that that intervention on its own would bring about a significant improvement in the health and well-being of the people of Nottinghamshire. So we have a burden of disease, we have a preventable disease, we have an inequity, and we are mandated by virtue of being the Health and Wellbeing Board representing the people of Nottinghamshire to intervene in that and in the pathway with regards to fluoridation of water. So we have already passed a motion to follow that pathway, and that's a pathway which we shall be proceeding over the coming months, and I will keep you all informed as we move along in that pathway. It's not far below that item number 2 talks about the alternatives or the additions that we can do to improve the dental health. And that's by giving toothbrushes and toothpaste out to people. And we've always had the brushing buddies in Nottinghamshire, which used to go into schools, teach people how to brush their own teeth, give them toothpaste, give them toothbrushes, etc. And that's a direct application of fluoride to the oral cavity to directly act on the various bacteria, karyogenic bacteria which degrade enamel and tooth mineralization, etc. Direct in the oral cavity. Fluoridation is present obviously in the system, it's ingested into the system, it works through the system, it reduces the mineralization, increases mineralization, and reduces again karyogenic bacteria by being present 24 hours a day in the saliva that's excreted into the mouth, and therefore is incomparable. And the World Health Organization puts it at the number 1 of in the top 10 of interventions that can be carried out that improve people's health. So it's supported by British Dental Association, supported by the World Health Organization, supported by Nottinghamshire County Council. So that is where we're up to with regards to fluoridation and toothbrushing, which is a very, very important adjective to oral health to the population of Nottinghamshire. support. There's a small area. We've heard an awful lot about crumbling schools and schools falling down, etc. But we've unveiled nothing less than 9.2 million of infrastructure improvements. Lucy, do you know anything about schools and monies and things?
I can confirm that the funding is for 35 million schools and will benefit from a range of improvements in the funding. Depends on schools, but the work can be replacements, range of improvements, and so a range of improvements
For the schools of Nottinghamshire. Fantastic. I'm going to throw that open in case anybody wants to have. Councillor Wilmot.
Thank you very much, Chairman. Can I thank the Chairman for his excellent report? I do that it contains the possibilities of healthcare in Nottinghamshire. The report flags the future of Great Britain's initiative led by Jamie Oliver and contains a link to an article about this project. Which funeral for children is the fourth emergency service? If we give 1,000 children
needs that emerge, and in fact it links to the paper that Irene will be presenting under agenda item subsequent in this meeting on family hubs, which is really around how we can maximise the support the families receive when they have additional needs.
Thank you. Carry on, Councillor Wilmot.
Just to say, an observation, in the Nottingham and Nottinghamshire Joint Forward Plan, it is good to see that the principles of prevention is better than care is being a priority. I'm really, I think it's a very, very positive move on that situation. But my question is, as I say, I also welcome the £76 million to give them to community organisations to help in the cost of living crisis. But my question on that is, what checks will be in place to see where the money is being spent of that 76 million?
Director Jonathan, would you be able to update us on the 76 million?
Councillor, you'll have to help me. Where are you reading the 76 million from? I'm adrift of.
Item number 8.
Got it. Thank you. Sorry. Thank you. Got it now. So, yeah, this will be, as I understand it, I think this will be something which our place department will be involved in distributing. So they will be employing the usual routine checks for those purposes to make sure that actually we're getting value for money in the county council.
I think you'd agree with me that it is essential that with so much money being distributed, that it is essential that we know where it's going and who's actually receiving some of that money. My next question. You say that domestic abuse in the report that is being tackled by delivering specialist sessions to grassroots football teams. That's very commendable. But would you agree with me? It's essential that we go into schools where the work needs to be prioritised through specialised teachers in domestic abuse, so that we knock the problem in the head before it.
I did present a couple of meetings ago on monies that had been directly given to Nottinghamshire for a direct domestic abuse approach in schools, where school teachers and workers have been trained to recognise children who lived in domestic abuse situations, and not only that, to actually provide counselling for those children. And that is a specific initiative that is currently ongoing and newly funded with new money in Nottinghamshire. So you're absolutely right, it is a priority, and we are currently investing funds, etc., directly into the schools and the children in order to do that at the present moment.
Thank you. And my last observation is that you say in the report about alcohol being a pressing problem. Again, I think it's essential that we look at early intervention schemes, and they need to be investigated to tackle the problem before it occurs. And obviously, I'm very concerned about some in the press, some of the things that are put in the press, almost telling you alcohol's so nice and good all the time. That and some people just carry on, drinking and get into serious problems with it. I wonder what your observation was in actually, limiting the amount of alcohol information in the newspapers.
I'm going to put that over to Jonathan Cribbin, Director of Public Health.
I'm having trouble with the microphones. I'm just going to shout and hope that you can hear. And I also know that within our combating substance misuse partnership that Councillor Carlton chairs for us, that although the government initially gave us 3 priorities, we included a 4th priority there, which is around addressing alcohol-related harm. So it's something, again, which the whole system is pleased to keep as a priority. Thank you.
Carry on, Councillor Wilmot.
That's it.
Okay,
Very much for allowing me to speak.
thank you for the question. We're going to go over to Kate Fole.
Thank you, Chairman. Thank you for the report. Clearly, it covers it's a wide scope, isn't it? And clearly, it's well-meaning. What strikes me about it is actually how little money actually that there is around to spend on some of these very important things. I mean, certainly, if you recall when we had your motion about fluoridisation, I mean, what we were asking the Labour group was actually what we need is a lot more dentists, NHS dentists. Although fluoridisation is important, actually it's dentists that we really need that are more easily accessible, and they're absolutely that they just aren't kind of nearly enough. And just to pick another one, I won't go through them all, but just to pick up the one as well about the Nottinghamshire schools, 9.2 investment's good, but when you think of the size and the state of the school estate, it's hardly any money at all, isn't it? Really, so it's good we've got it, but it's nowhere near enough again. So thank you, but again, I think we need a bit more. We need a bit more kind of public spending, don't we? I think across the piece. So thank you.
Yes, indeed, dentists would be a great addition, although it take a long time to train and seem to largely work in the private sector. So it's a big challenge, and again, secondary prevention largely in dealing with the challenge of already existing dental caries as necessary, opposed to the prevention, which is significant through fluoridation. But yes, no doubt, intervention is a culmination of all of those things, from toothpaste to dentists, etc. And anybody got a comment on the amount of investment, Lucy, in the schools? It is what it is. But more investment always beneficial. Lynn.
Moving back to the dental caries, dentists. It would be great to see a lot more dentists, and unfortunately, if dentists prefer to work in the private sector, then perhaps we need to make it more beneficial to work in the NHS and to provide care to everybody. I commend the fact that we're going to look to give toothpaste and toothbrushes to children and young people, and I note in the report it talks about giving them to food banks to distribute. The concern I've got is, do all food banks work in the same manner, and do they all provide food in the same manner? And does this give equity to all children and young people? And would we not be better looking at the amount of children and young people on free school meals and maybe distributing them via the HAF programme or something like that? So so that we've got better equity moving forward. It talks about food banks and other organisations, and perhaps it would be good to come back to the board at a future date and tell us which other organisations, so that as councillors we can ensure that children and young people in our districts are actually being able to take part in this. I also commend the fact that we're looking at domestic abuse and looking at grassroots sport, because we know that there are connections. I just wanted to draw attention to an initiative in Bassetlaw District Council that we're actually undergoing at the moment, which is called the DAHA, the Domestic Abuse Accreditation, Housing Accreditation, whereby all district council staff will have some training in recognising and dealing with or signposting for domestic abuse support. And I would actually ask all district councils to be part of this, and perhaps the county council to look at how they can undertake this accreditation in the future. Thank you.
Yes, thanks, Lynn. Again, I'll go back to the certainly pre-COVID Brushing Buddies initiative that Nottinghamshire County Council has had in place for a number of years, specifically addressing children from the lower socioeconomic background and giving them toothbrushes, giving them toothpaste, showing them how to brush, and also involving the families in that. So it's a well-recognised initiative which we've had at Nottinghamshire County Council for quite a long period of time in terms of that. We may touch on other ways of reaching out when we get to the children's and the family hubs in due course. Jonathan, have you got anything to add to that?
I will. Yeah, thank you for your comment and your suggestions. So regarding the specific initiative here, in response to your questions, let me take away something, an action through Lizzie, if I may. We'll come back in terms of offering a comment around how the different food banks work, because you're quite right. There's that represents quite a degree of variety, and we'd be pleased to consider what other options there are for delivering that intervention in a way that is equitable. Because as a targeted intervention, it is, you're absolutely right, key that it has maximum impact amongst those who are least advantaged. If I kind of segue from that theme to come back to fluoridation, it's one of the reasons why an intervention like that is so powerful, because it has potential to deliver that kind of equity right across the whole population, and not only for children, but for people throughout the life course as well. So these are things that we need to hold together, the very targeted interventions alongside the universal. But thank you for your challenge. And regarding DAHA, yeah, absolutely. We're so pleased to see the initiatives that have been taken forward in the council. It's something that the Domestic Abuse Partnership Board took a look at recently, and it might be something that you feel is worth bringing back to the Health and Wellbeing Board at an appropriate opportunity, to equip and motivate a wider number of partners to take up your challenge. Thank you.
Councillor Jackson.
Thank you. Councillor Jackson from Mansfield District Council. I just wanted to comment that Mansfield District Council has already progressed with the DAHA accreditation. So I just wanted to make that comment. Thank you.
Thank you, Councillor Jackson. Move anywhere you like, Councillor Tideswell. Yeah, we'll wait. It'll probably start raining now to move around there. Excellent. So, yes, we're moving on to the new development of family hubs in Nottinghamshire. Largely, we've been familiar with children's centres, but this is a much... I will give a couple of seconds. Adrian, did you want us to turn off the mics and see if we can solve any problem?
Is it not connecting to you?
Let's just take 2 seconds to see if we can improve the very expensive speaker system. I got to turn it off for a... Is it better up there, Councillor Tideswell?
My headache is getting better. But the problem is a lot of people don't realise that these are only directional mics and not unidirectional. If you turn away from them, the volume doesn't come through very well. If you speak into the mic, it comes out a lot better. Okay.
Thank you for that. Okay, so we're going to go across to Irene Kakulis of the Early Childhood Services to update us on the development and implementation of family hubs in Nottinghamshire, which I think is a very exciting and a very comprehensive offer. Over to you, Irene.
Thank you very much. And I apologise, some of you that were here at the last Health and Wellbeing Board are probably sick of hearing about this now. So thank you for inviting me again. The difference with the presentations, the updates I'm going to give you, last time we were talking about the Best Start strategy, which focused on supporting families from conception to 4. And actually family hubs now, we're talking about the whole family hub offer, which is supporting families who've got children aged 0 to 19 and 19 to 24-year-olds if they have special educational needs or disabilities. So I'll try and focus more on the bits you've not heard rather than the Best Start for Life offer. I'm actually group manager for early childhood services in the county council and have got a lead for family hubs, children's centres and family hubs. Family hubs are very much based on how children's centres were first developed, partnership working, community-based, community empowerment. So it's the next stage really for that service. I wanted to just kind of remind people about what family hubs are about. We need to improve access to services for our families. They want information, advice and guidance, but we know that they really struggle to navigate the system. There are so many services available and they differ depending on where you live, that as professionals, if we don't know how to access the services, how on earth are we expecting families to do that? We need to reduce those barriers. That's absolutely one of the critical areas that we need to focus on when we develop family hubs. We've got to make it easier. And one of the ways of making it easier for those families to access services is by those services working together and not working in silos. I'm not saying that was done on purpose. I think some organisations, county councils guilty of it. You get your head down, you start a piece of work. Everybody does this when we're busy. Actually, now's the time to kind of look up and work with others across Nottinghamshire. The term Family Hub Network is an umbrella term for a network of services. It isn't about one organisation doing it all. The diagram on page 1 shows you the core offer that we're intending to provide in each Family Hub network. So it starts from conception with Best Start for Life and then supporting families, supporting young people, supporting children and families with special educational needs. To do this, we have to work in partnership. We have got a Family Hubs partnership group that includes place-based partnerships, district councils, DWP, Job Centre Plus, you name it, trying to get this core offer off the ground really and confirm what it is that we can all offer. Each Family Hub network will be different depending on what is available within that local community and what the data tells us are the priorities in that community as well. I think what we're trying to achieve, if you look at paragraph 7 on the report, I'm hoping nobody would challenge any of those ambitions that we have. They make sense. We've talked already about access. We've got to work efficiently together as partners, but we really want to strengthen the relationships that we have with families and professionals, building that trust, making sure services are family friendly and not saying to a family, sorry, you don't meet this threshold, bye-bye. It's more about actually, if we can't support you, who else can? And then try and get those systems in place. Just want to mention to you, I'm not going to go through all of this, don't worry. Targeting priority neighbourhoods, it's an absolute priority for us to make sure that families in certain areas are targeted and supported. We need to do a lot of outreach work as a partnership to target and engage underrepresented groups. Family Hub networks are not about buildings. We don't expect to sit there and wait for families to walk in through the door. Some families need a bit of hand-holding. They need that trusted relationship first. And that's one of the areas that we're looking at doing. So Family Hub networks, at the moment, we propose that there are 1 to 3 in each district, that there is one main building as part of that network, but a range of different spokes. And those spokes could be schools, citizens' advice, libraries, websites, virtual parenting programs, a range of different things that we have available. We have to do that outreach work for it to work. We know that we want these one-stop shops, but we've absolutely got to focus on those underrepresented groups that don't come into these buildings. I think probably people are going to be interested in paragraphs 15 and 16. At the moment, we have drafted a paper that's going to go to the council, county council cabinet in November, which proposes that we roll out family hubs. At the moment, we've got design sites. The first family hub network has been launched in Retford, followed by Newark and then Sutton in Ashfield. Those design sites, work has already started in those areas. And then we propose we have another 2 design sites, one covering Oak Tree and Ravensdale in Mansfield, and the other covering Netherfield in Gedling. If we can get approval for those 2 new ones, we will have those design sites, and then we want to have approval to roll family hubs out across Nottinghamshire. And the table on paragraph 15 shows you the proposals that we have in place about where those family hub networks will be across Nottinghamshire, with Rushcliffe only having 1 family hub network. But actually, if I look at the Children's Centre team, just as an example in Rushcliffe, the partnership work there is absolutely phenomenal, because they haven't got a lot of buildings and they do a lot of outreach. So actually that model does work, and they do target those underrepresented groups. So it's going to be a mix, really, of lots of outreach work, building-based and virtual programmes. Taking us through this, really, the other final thing I wanted to say, because I'm aware that we haven't got a lot of time today, that place-based partnerships and family hubs kind of go hand in hand. Those of you that are involved in place-based partnerships, we're talking about community development, we're talking about health inequalities, we're talking about engaging in all those underrepresented groups. So place-based partnerships have really embraced this, which is fantastic. And there's a lot of work happening around that, how we can join up in terms of governance arrangements, in terms of delivering best start services within those areas, as well as wider services for children and young people, including young people's mental health. And then we have some next steps which form part of the recommendation. So we propose progress the phased rollout depending on cabinet approval. Launch public consultation, again that will be linked to cabinet approval. So we need to try and get that out, and it won't just be virtual and online. There will be staff from across the partnership, hard copies going into schools, going to talk to parents and carers and wider stakeholders to get the views from them about actually what should this family hub network in this area focus on, not just do you agree that we have one. It's an opportunity for us to gather that information and then build on that, doing lots more co-production activities with families. I've lost my page now because I don't have a stapler. Paragraph 32, found it. We will do more in terms of the Best Start for Life offer, which we've talked about in depth at the last meeting, and the virtual family hub, which will be, at the moment is Not Help Yourself, but we're going to do a lot more work now with families to try and improve that, make it more accessible and promote that website. I suspect some people use it, some people don't, so there's a lot we need to do. We will look at and review systems and processes, and that's very much around reducing those barriers to access for services. We will also engage more with schools, so the co-production work we've done so far has very much shown that there is a gap in services for children, especially of primary school age, who have those emerging needs. Fine if they have entrenched needs and have you need to access a specialist service, there might be a waiting list occasionally. I won't name services, but we need to do more and getting there much earlier and help schools to do that. It isn't about us taking over from schools, it's working together. We also will have a Family Hub's outcomes framework that won't just be looking at, well, did this service, did this intervention work? What we want to really look at is what has been the journey for that family through the whole system, through that network, through the early help system that we have at the moment. Were they turned away? Were they supported to access something else? Were they listened to? There's a lot we need to do in terms of the wider outcomes. What will be the impact of these Family Hub networks? And that's what we're piloting at the moment in the design site areas. And then finally, in terms of next steps, is trying to progress information sharing agreements. So I'll give you an example where we have some services that might work in a children's centre building. Fantastic, they come in 3 times a week, lots of clinics, lots of families coming in, but actually then that service may just walk out and not discuss with us, well, actually, we've got a family here who could do with help from this organisation, that organisation, because we haven't got those information sharing agreements in place. We do have some, please, I want to reassure you, but there are some services that we need to do more with, maternity being the big one. We've got 3 maternity services across Nottinghamshire. So that's it in terms of the report. Do you want me to go through the recommendations, or is that something you want to do, Chair? Okay. Yeah, that's fine. So recommendations really then to acknowledge the work that's progressed so far to establish family hub networks, to endorse the suggested next steps for the effective rollout, and consider where there are actions required by the board in relation to support for the developments and the wider implementation of family hubs.
Thank you, Irene. It's a big extension going from pregnancy the whole way through to young adulthood, and obviously a big offer for the young people of Nottinghamshire. And you've got to look at it, the child who goes to school and fails an exam, and one child, they'll never want to do an exam again because they failed it, and another child will turn around and say, I failed that one, but I'm never going to fail another one again. And the key that separates kids tends to be the development of resilience. Resilience built from families, built from extended families, built from communities, and hopefully as we go forward from family hubs, allowing people in places, place-based partnership, etc., to develop community childhood resilience to keep the children going. I'm going to throw it open to any questions, and Councillor Jonathan Wheeler.
Thank you, Chairman. Thanks for the report. I just want to endorse comments made about the fact that having hubs is great. It's actually about going to the areas and targeting those set communities. So, Rushcliffe has already said we have specific areas that do need intervention rather than more widespread across the area. So, areas like Cot Road, for example. So, rather than just doing something targeted one area, we actually go into those set communities. I mean, one of the great partnerships we do is actually with Nottinghamshire County Cricket Club. It's called Positive Futures, where actually we teamed up with their charitable arm, and actually our team, along with theirs, go out there. We have 7-level agreements. We're out there and providing support to young people, as well as going to areas to speak to the families and give advice. We had one in Bingham, for example, where stall in the marketplace, really high density footfall, and we had just to have chats with people, talk about healthy living and so on. And so that's why I really think it's important that though we have these hubs, we've got to remember you've got to go out to where these people are, live, they work, and enjoy themselves, because not many people actually come to one location wanting help. Actually, we need to go out there and actually offer it and make it look not so scary, and then hopefully we get more engagement. Thank you.
Street by street, door by door, Jonathan. Tell him.
Thank you, Chair. And thank you very much, Irene, for that report. And really welcome the approach of Family Hub, and also a couple of comments and then probably a question, just some feedback. So I do have, in terms of a clinician or a frontline service delivery, navigating the current system can be, it's really complex. So one-stop approach, and equally further down the principles of joint up working, linking with other services, that's the crucial bit in doing it, because otherwise, as a clinician, I can feel frustrated not knowing where to or signpost or offer the support. Just imagine what a parent would be feeling, and so therefore that's really welcome. So the universal offer, one-stop shop, that's really what we need to go, and the principles of access, connected, and relationship based on relationship. Yes, so and also welcome the further progress and the development across the sub districts. My question was, now we know Redford went live this April, and there'll be 4 other sites going live next April. Would be really keen to understand learnings from Redford. What has worked well? What has been different? And how can that be replicated and adapted, whether it's Mansfield, Ashfield, Broxton, etc.? Because that's the crucial bit. What's different? How is this going to work when previous iterations or attempts haven't worked? And not only from parents understanding their feedback, but also from clinicians and the other work who would signpost and get their feedback as well when referred into. So that bit I'm really interested in. It's not a full-scale evaluation, but understanding early learnings. How is this working now, and what can we do even better? Thank you.
Thank you. Yeah, that is a good question, and this is partly why we decided on the design site process, really, so that we could learn from what's happening. It's an interesting story in Retford because actually we found lots of successes which already are starting to be used across the area. I think probably one of the biggest successes in Retford was starting with families. We didn't go in with an idea of what it was we wanted. We actually went and said, "What's it like living around here? What are the issues? What do you think needs to improve?" But went in quite positively, and then built on that because we had lots of relationships. We did the same with young people. We actually did the same with professionals in the end. What's good about working here and where do you think the gaps are? We opened that dialogue, and then that co-production work has just gone from strength to strength. It's been published nationally as well, which is fantastic. So we're doing that in all the other areas now. So that's the good bit. Some of the challenges that we've had, some partners are reluctant. Not many, I have to say. Most partners are fully on board with this. But I think one of the challenges that we have is with all the partnership, we want the Family Hub network to have lots and lots of access points. So we need to make sure that those access points have got the right information and training. And that means you might work with a parent, but are you actually asking other children in the family and what's going on with the children? So it could be somebody's gone in to sign for their benefits. What's going on for that family? It's asking and thinking whole family all the time. That's going to be a challenge for some organisations that have quite a narrow focus and are busy. That's the other issue, is capacity. So it's just about thinking differently and think family. That will be probably the biggest challenge that we have. So going out now with the other design sites, the first thing we do, so we start the conversation with families, but we go to those partners on the ground. What is happening for you? What do you think? What are going to be your challenges? So there's lots more than that as well.
Thank you, Councillor Fall.
Oh yeah, thank you. Yeah, just to comment on your comments, Councillor Duddy, I do worry when people talk about resilience. I mean, anybody who's met parents or carers with a child with special educational needs or kind of mental health illness will know that resilience isn't the problem. It's them feeling valued, that actually they can get access to a service in a reasonable time. Some of the waiting lists for children with SEND and I think some adults as well is awful. It's years in some case, and I think that's really what we need to tackle. And I think it's something that I think, in terms of saying that, families want resilience, what they want is a decent service, and a lot of them are not getting that. And I think we've got to be honest and recognise that. And it's been going on for a long time. I mean, it's not just happened to come last year. So just something. And some of these children need better access to some of the services. Have I gone off now? No, I've gone off. Okay. I think the early intervention is really important, isn't it? What worries me is everybody's talking about early intervention, understands the value of it, which is great, but there's no funding for it. I mean, if you just think about the Hewitt review, for example, when she suggested that 1% of the health and social care budget should be spent on early intervention, 1%. I mean, it's peanuts, isn't it? Really, compared to what's being kind of spent further down the line, when actually it gets a lot more expensive. And I think we all understand that argument, don't we, really? So just to say, yeah, we need to, and I think I agree with a lot of the comments that have been made about impact. We've got to know this is making a difference, haven't we? We really have got to know that. So that would be my big question. How are we going to know this is having an impact? And I would say in particular, I'd like to think about children with SEND and with mental health issues and younger adults, because there is a pandemic of mental health, poor health now that is just awful in a civilised country, in my view. Thank you.
I'm going to continue before we take an answer on that and ask Lynn and Councillor Jackson to ask the questions, and then we'll answer them as comprehensively as possible as one after that. Lynn.
Mine is quite quickly replicating over the rural areas, because I note that you have Harworth in the rural areas, including Carlton and Lindrick. So you've gone from Carlton and Lindrick. I'm assuming you're going all the way out to Misterton as the rural areas. That's a massive expanse. And how can we co-produce from a town that isn't there won't be the same needs in Haworth and Birkouts as there are in Carlton and Lindrick, in Misterton and the small rural villages. So it's going to be difficult to reproduce on the model that you've used in a small, compact market town such as Retford.
Councillor Jackson, I'm going to take your question. We're going to go for an answer, and then we're going, because we have to finish by 3, we're going to move on after Councillor Jackson's question. Go ahead, Councillor Jackson.
Thank you, Chair. I'm seeking some assurance, really, and you have referred to partnership working, outreach working, and some partners maybe not being as keen. And this does fit in with what Councillor Wilmot picked up from the Chair's report about alcohol use. In Mansfield, for example, the drug and alcohol services flat out don't do outreach work. So I would like some assurance that you've engaged with them and considered how you might incorporate that into your family hub, because that's absolutely vital. Thank you.
Irene, would you like to comment on that? And then we'll go to the recommendations after that. Thank you.
I want to work backwards, if that's okay, with the 3 questions. Just going with ease, I think. So yeah, the first one around, so the Substance Use Service CGL are a key partner. They've been coming to the Family Hub partnership since it started in 21. So they are there. And I think in terms of the outreach work, again, it's they shouldn't have to do everything. Actually, if we've got staff on the ground doing the outreach, they need to be asking and identifying about alcohol. We do have assessments that we use. Health and Wellbeing is there, emotional health and wellbeing. So all of that, domestic abuse is on there. So we do ask those questions. We do that, and then we can bring them in to access those services. That was the easy one. The next one, so Bassett Law. Yeah, Bassett Law is a fascinating area. It's so big, and that's partly why we wanted to do a design site there that was in a town, but also covering the surrounding areas. When we're talking about sort of all of the rural areas in Bassett Law, we have to target where we do the co-production. That will be the same across Nottinghamshire. So there'll be county-wide consultation that everybody can access, but then we need to really drill down to engage the families in the target areas and those underrepresented groups. If we get it right for them, we should be able to get it right for others. So if we think about teenage parents, for example, their needs are, I mean, they are far too embarrassed to walk into a building without having some support to do that. So we need to go out to them. We need to engage them where they are at the moment. So it's going to be targeted. I can't promise that we'll be doing co-production absolutely everywhere, but we will consult everywhere. Have I answered your question there?
Thank you, and thank you all for your contributions.
Possible I can just have one question, a very quick one.
You can have one in the next item. How's that, Councillor Wilmot? There we go. We're going to move to the recommendations. The family hubs bring together family support services, providing support early when families need them. Family hubs can support families, particularly in the first 100,001 days, and provide cross-cutting early help solution to complex problems, and the recommendations as outlined by Irene earlier on. All those in favour, raise your hands. Okay, moving swiftly onwards. Be prepared, Councillor Wilmot will be coming back to you shortly. This one is on the Joint Strategic Needs Assessment. The whole of health and wellbeing is revolving around understanding the needs and the assessments of the communities in which we live, and joining up the needs with the provisions and the interventions, some fast moving like neurodiversity, some which have been present from the age of time, smoking, alcohol, obesity, etc. In the Joint Strategic Needs Assessment work programme, we've started to address how we can do that in a more refined way, and what we need to prioritise in the weeks and months coming forward with the challenges. And with that, I'm going to go over to Will Leather.
Thanks, Chair. So I'll try and be very brief. I'd assume that you read the paper. Hopefully it's fairly self-explanatory in terms of what it's setting out, but just very briefly. So the Joint Strategic Needs Assessment, the JSNA, as Councillor Dudley was explaining, it's designed to assess the current and future health and social care needs of the local system, so we can enable evidence-based planning and decision-making. And it's a joint responsibility between the council and NHS as well. So and the information that we publish is available. It's on Nottinghamshire Insight, so it's there available for commissioners, for a whole range of professionals to plan service delivery and interventions. So each year we go through a prioritisation process. So we invite partners to submit topics of joint interest and strategic importance, and we assess those against a set of criteria. So that's looking at things like upcoming recommissioning, changes to national and local strategies, new evidence base, because there's no point in putting investment behind doing the JSNA if it's not actually going to lead to impact. So that's involved the board here, it's involved partners in the ICB, the Integrated Care Board, place-based partnerships, and across the county and district councils as well. So the proposed work programme set out in the paper. I won't go through it all. The rationale for each of those is set out, and I'd be happy to take any questions on those. The paper also just briefly talks about some refinements that we're proposing to that annual process. So one of the bits of feedback that we've had is around sometimes we get emerging issues that crop up throughout the year, and it'd be helpful to have some flexibility around the work programme so that we can make some changes as those come up. So we'll continue, the proposal is to continue this process where we come to the board with an annual work programme, but working through the chair if there's anything, any new priorities that emerge that we want to add on. And then finally, the paper sets out some other improvements that we're doing around the JSNA to maximise its reach and its impact. One of those is around developing some alternative formats of the JSNA. So one thing that we're trialling is something called profile packs. So traditionally you would have seen, hopefully, we produce full chapters which are very detailed, in-depth analysis of a topic, which can serve its purpose and can be really useful, but it's not always fit for the situation. So we're developing an alternative which is much more succinct, much more visual and hopefully engaging for the target audience, and designed to be much more rapid so that we can turn around that evidence and have the impact much quicker. And then also around developing data dashboards, so presenting data in charts and other visuals, so we provide that high-level summary that complements the narrative. So it's a bit of a landing point on a specific topic, so we can see that information that's more regularly updated. And we're also looking, the JSNA is not the only source of evidence across the system, so we're looking to integrate with partners, so working with NHS colleagues in the system, analytics intelligence unit, so we're not duplicating, actually we're working together and providing one version of the truth across the whole system. So hopefully I've kept that short and brief. I'm happy to take any questions.
Yes, thank you, Will. When you look at it and you look at the extra topics that come up on autism, neurodiversity, etc., it will be easy to think that this is the expanse of the Joint Strategic Needs Assessment, but these are additional new chapters in addition to the 42 existing chapters that are on Nottinghamshire Insight, full comprehensive chapters which are constantly being re-updated and refreshed. So this is in addition to all of the work that we're doing, new areas that we want to introduce. Would that be fair?
Yeah, absolutely. We've got a whole wealth of intelligence and knowledge that's already there, that's already published. This is about focusing our resource to update on the aspects that we think will have the biggest impact.
I'm going to throw that open in case anybody's got any questions. Councillor Wilmot.
Thank you, Chair, for allowing me to speak. Paragraph 16 lists the work programme and indeed priorities of our joint strategic needs assessment. There are some crucial issues on there, including health inequalities and community resilience. My question relates to what was not included in the topic proposals. I talk specifically about the fact that violence against women and girls and severe mental illness were not included because, according to the words contained in paragraph 16, were not a priority. I appreciate that you use a scoring process, but this sends out the wrong message to people. Can you give an update on violence against women and girls, a firm priority of councils and indeed Commissioner Henry and the Police and Crime Commissioner? make it a firm priority. The report states it has been sidelined to allow new leadership and strategy arrangements to bed in locally. What does this actually mean in practice? And further to this, can you give me a few examples of what we have achieved through this process, as it's not clear from the report? And Chairman, I'm a little bit concerned that the amount of time that's been allocated for this meeting and the amount of agenda items are far too many, and it doesn't give everybody the opportunity to speak about all the issues. Thank you very much.
Thank you, Councillor Wilmot. I do remember a couple of meetings ago presenting a paper on domestic abuse, which was looking at the post-COVID recovery and impact, etc. And we had a significant proportion of the whole meeting devoted to an update on the council and its work in domestic abuse and domestic violence. I'm going to go over to Will.
Yeah, to start. So apologies that language probably is sending the wrong message in terms of priorities. Absolutely recognise that violence against women and girls and severe mental illness is a priority for the system. I think what I was trying to get across in the paper is that it's, for instance, in terms of severe mental illness, we've already got some existing intelligence products that are in the system, so that's supporting that priority. We've got the evidence base there, so through the scoring process, we identified that the JSNA would only duplicate what was already there. So to make use of that existing intelligence, and in case of the violence against women and girls proposal, as it says, there's some movement around leadership and strategy development, so it wasn't felt that it was the right time to do a JSNA, and that's where I think the refinement to the process so that we can make a change in year. So say we come to January time perhaps, and we look at that again and decide that actually we need that resource for the JSNA on violence against women and girls. So it's a flexible approach. I don't know, Jonathan, if you want to add any more in terms of that.
There's nothing I need to add to that, I think. Thanks, Chair.
And I would encourage anybody who has not been on to the Nottinghamshire Insight site and scrolled down and pulled off some of the extraordinarily detailed JSNAs that exist of the 42. Many of them run into over 100 pages. It's my first port of call if I've got anything that I'm looking into in any aspect of Nottinghamshire. My first port of call for information is the JSNA on the Nottinghamshire Insight site. And would recommend that, Councillor Wilmot, to a number of those areas that you mentioned, as they are already in existence, etc. So I'm going to move swiftly forward as we just past 3 o'clock. We're going to ask that the Health and Wellbeing Board approve the JSNA work programme, approve the refinements to the prioritisation to give greater flexibility, and note other work being undertaken to maximise its impact and reach. All those in favour? Passed. We're going to move now to the last item before we break for coffee and biscuits and a workshop, and that is the Better Care Fund planning requirements. Sarah Fleming.
Thank you, Chair. I'm here with Bridget Cameron as well and Donna Smith. So the report is to ask the board to ratify the Nottinghamshire Better Care Fund plan for 2023 to 25. So many of you will know that the Better Care Fund has now been around for 10 years, with 10-year anniversary this year. It creates a pool of NHS and local authority monies really aimed at increasing the scale and pace of integration and promoting joint planning, which really is about supporting the sustainability of our health and care economies. Within the report, you'll see there are a number of national conditions that we need to meet. This is around having a joint plan that's signed off by the Health and Wellbeing Board. We need to meet the Better Care Fund objectives, which are around enabling people to stay well, safe and independent at home and providing the right care in the right place at the right time. We have a number of metrics that are linked to this, which are detailed in paragraph 7 of the report, and we do monitor that on a regular basis, and we will be bringing those performance reports back to the Health and Wellbeing Board. The plan and the metrics are jointly owned by both the local authority and the ICB. The narrative plan that has been attached for your information as well and your
sign off is around, we do that at an ICS level, so that we recognise that there are a number of areas where we do jointly plan across the city and the county, so that's why we currently have that joint narrative plan, and it also reflects our integrated care strategy, which is shared at the ICS level. So the timing for the submission to NHS England often precludes us coming to the committee for sign-off before we have to submit to NHS England. So as per the agreed delegation arrangements, Councillor Doddy, Melanie Williams and Amanda Sullivan did sign off the plan that you've got attached to allow us to submit to NHS England within their planning timelines. We've previously held a workshop with the Health and Wellbeing Board, recognising there's a number of new members, where we really went into the detail of the Better Care Fund, because we do appreciate there's a lot of detail within the plan, and we are hoping to have another workshop soon, which is around the next phase of planning, where we really want to get into the detail of those schemes, work with our place-based partnerships to really understand what those sum of models of care and actually how can we make them really locally sensitive. So we're currently working through that workshop, which you'll all be invited to. So, Chair, the board's asked to ratify the BCF narrative plan and the templates that you have in the report.
Yes, that is correct. That is the recommendation. And there's never been a more exciting fund than the Better Care Fund, particularly the expanded Better Care Fund, which has millions of pounds of new investment, and whereas traditionally it was always seen as a very transactional fund, money in, money out, the opportunity for working with place-based partnerships, etc., to expand into the preventative agenda is what our last workshop was about, and what our next workshop will equally be about. What do we spend the money on? Do we continue spending it on that? Do we reduce it? Do we stop it? A great opportunity for revisiting the Better Care Fund, and that's where our next workshop will bring us to the opportunities that we can have to spend some of that money in a more preventative manner within the place-based partnerships, etc., which has previously not actually been an option because there was never any money left over. So I'm going to throw that open in case there's any questions out there for anybody to ask.
One quick question.
It doesn't have to be quick, Councillor Wilmot. You take your time.
Thank you very much. This is a crucial service, and it involves a huge amount of money. It's entirely sensible to pool the budgets with the NHS and the partners. My question is about we are being asked to do today, what we're being asked to do today. This is to ratify the Nottinghamshire 2023-25 Better Care Fund planning templates that are submitted to, which were submitted to NHS England on the 28th of June 2023. I've concerned about the real-term cuts in funding due to inflationary factors, but the reality is that we're being asked this afternoon to note this report, as there is literally nothing we can change about it because it's already been submitted. Am I correct in that pronunciation?
I think historically they've always been presented in retrospect, and it was just a statutory obligation that we had in that respect. We are sort of moving towards some changes with regards to that to make it more dynamic in the way we present it and the earliness of which we present it, and the opportunities to make change within it. And that was the whole purpose of our last workshop and our next workshop going forward. So although you're correct in what you say is current, then the idea going forward is that that will not be the case, but it has always been a historical case that we retrospectively approve things because of time, because of constraints, and because of the way the fund worked. Do you have anything further to say on that?
So just to say, the commissioning responsibilities sit with both the local authority and the ICB. The Health and Wellbeing Board is absolutely the partnership forum where actually we recognise there is a greater benefit in how we bring partners together. And I think that is the work we've been trying to do, is actually say, how can we stop this feeling that it comes in retrospect and that it can't be changed? We want to start being much more proactive. So we recognise again this year we haven't achieved that, but I think the next workshop is really about us trying to shape and influence that. The commissioning responsibilities do remain with those commissioning organisations. That is sort of statutory responsibilities, but actually I think it's incumbent on all of us to say, how do we plan most effectively working with our communities?
Excellent, and must be just reminded that this is a fund where the NHS and local government get together to share a pool of money under special arrangements, as NHS money cannot be spent outside the NHS without special arrangements like Section 75 has been in place, and it is going to be, watch this spot, Councillor Wilmot, an exciting place to be as we move forward. I'm going to put forward the recommendation that we ratify the 2023-2025 Better Care Fund planning template that we're submitting to NHS England on the 28th of June 2023. Dr. Bartholomew, could you second that? Mr. Chair. All those in favour? Excellent. So we're going to briefly just look at the work programme as is in front of you. It's very interesting that the next one may actually be a external review of the work of the Health and Wellbeing Board. And speaking of external reviews, we're about to get a really exciting update on an external review of the whole of Nottinghamshire County Council, CQC, self-assessment, feedback from people, feedback from carers. This is the type of stuff that you cry out for and say, what are we doing to look at ourselves to see if we're doing things correctly? And this is the exact document that would actually feed back to that. So I'm going to ask if we could all move to the assembly rooms, have a cup of coffee, have some biscuits, take your seat at the table, and we're in for an exciting hour or thereabouts. Thank you very much. Right,